Hi, everybody. My name is Angela Berger. I am the social worker and program manager for our transition to adult care program at Lurie Children's Hospital. We're super happy to be with you today. And
I'm Parag Shah. I'm a pediatrician, and together Angela and I do the transition to adult care team at Lurie Children's Hospital. And we're here to talk to you all about some of the, just an introduction to the topic, some of the things that you all might want to think about. Just kind of go through it like we listed it here, kind of transition to adult care 101, and we'll see how it goes.
And with a small group, we want this to be helpful to you guys, and it doesn't have to be super formal. So, we can definitely wait to the end and have questions, but certainly if there's something you see a slide and you really have a question or want to add something, or let's do a back and forth. Let's have it be helpful for you folks that are here. So we don't want it to be kind of stuffy. We'll do the slides, but certainly if folks want to jump in and share experiences or have questions, we want folks to be able to do that as well.
We've done this before, and we know that the group gets a lot out of doing sharing your own experiences, asking questions. We know that sometimes the group gets a lot more out of that. Before we start, do you want to know, who do we have here? Is parents? Caregivers, guardians or caregivers, and educators or professionals? Industry. Okay, great. So mainly parents and somebody from industry. That's interesting. I love to. Please feel free to speak up. That's not a typical thing for us. So. Yeah. Nice. Yes. All right. So we'll talk a little bit about what we mean by transition, some of the facts and the challenges and the barriers, how to start thinking about transition, what to think about when you actually are transferring the care for your loved one, and some specific issues. And then we will, talk about just some of the things that we're doing at Lurie Children's, more because no matter where you're getting care, a lot of people are doing the same stuff. This isn't, specific to Lurie Children's. So you might find it at your institution or might give you some ideas wherever it is that you end up getting your care. So just to start off, just to let people know, the actual definition of transition, there is a fancy one out there. The main thing here that your providers and you all should be taking out of this is that we really want this to be a purposeful and planned process. This isn't like one day you hit a certain age and all of a sudden somebody's like, all right, see ya, good luck. And it used to be that way for a long, long time, and it still is in many scenarios and many circumstances. So that's why I just like to highlight this definition and the words purposeful and planned, and knowing that that's what maybe you all can think about for your loved ones, along with your provider should be thinking about for you all. Let me just take 1 second here. I just want to make sure we just load it on right here. Oh, yeah. Okay.
So we do know that when it's not purposeful and planned, that there are challenges and barriers and health outcomes that are definitely suboptimal. Definitely in the research around healthcare transition, we know that if folks are kind of just dumped out of care unceremoniously, especially with a complex medical program, that it leads to definitely poor outcomes for everybody, for the family, for the health system. So that definitely is something we talk about when we talk about that definition from the American Academy of Pediatrics. So here are some known barriers that our families tend to come up against. And again, we're not going to necessarily read every single thing on the slide, but you may definitely identify with some of these things on the screen, right? So we know that our families and patients talk about how there's a culture difference between the pediatric world and adult healthcare, right? That's very real. And nervousness about going to somebody that doesn't know anything about my child, right? So a lot of people describe it to me as these people are my family. My child has been coming here to this hospital since they were a baby, and everybody knows me here. When we come to a doctor's appointment, I don't have to, tell my child's whole story. They know me, the nurses know me, the front desk knows me, and going to a new medical institution is really scary and overwhelming, and you wonder if you're going to get the same quality of care. So these are very real fears that our families have, for sure, and a big part of healthcare transition planning. Our providers have reported well, who am I going to send these kids to, right? A lack of physicians who are willing and knowledge of pediatric conditions, poor reimbursement, their own reluctance. And a lot of people say, well, they're doctors. They should know how to take care of everything. But what we do know is complex medical conditions that start in the pediatric phase. Through the magic of pediatrics, our young people are living healthier, better lives into adulthood, where maybe 20, 25, 30 years ago, our young people were not surviving in the numbers they are now. So actually, a lot of our adult counterparts are fantastic people, but they're not used to this category of young people coming up into their practices. So part of the work we'll do and that we talk about is trying to find adult providers that want to take care of our kids, because they take more time to take care of, right? And, poor reimbursement, depending on insurances, number of minutes that providers have. You go to see your own doctor. Oh, they've got 15 minutes for you. You're kind of in and out. These are not 15-minute appointments, right? So these are all challenges adult providers have reported in the literature and to us when we go around and talk to adult providers. And the adult providers themselves say a lack of training for some of these very specific disorders, difficulty meeting the psychosocial needs, lack of time and reimbursement, lack of the coordinated care transfer from the pediatric world to the adult world. Some of the culture difference comes into the availability of nurses, social workers, and case managers. We find that generally, on the whole, those services are more abundant, I would say, in the pediatric world than sometimes in the adult world. That's not, universal, certainly, but we've had a lot of families say, I can't get a hold of the nurse on the adult side, or I used to have a social worker and maybe this clinic doesn't have a social worker. So the adult world and the children's world are different. We try not to, couch it in better or worse, but they're just different worlds with a different culture.
Does anybody here have your granddaughter or your daughter going to the adult care?
She's 18.
Right.
Okay.
She'll be 18.
Okay.
Gotcha. He's 17.
Yeah.
Gotcha. But nobody's seeing an adult primary care doctor or an adult neurologist or anything like that.
We have one. She's been Children's Hospital for her entire life.
Yeah.
But she did BPS surgery, brain stimulation surgery, and children had lost their program, so we went to University Hospital. It was a shock. We don't call it so. We don't talk to each
It
other.
was different, right?
It was, so we're linked to them now for the duration of her life.
Yeah, but it is different.
And that tends to be the common theme. And we work at a children's
Right.
hospital, and we're in the pediatric world, so obviously little chip on your shoulder thinking that we're better than But the reality is there are some cultural differences, and a lot of this has to do with the funding that's available and the structure of how adult centers are built. Like Angela mentioned, one of the big ones is that they just don't have the kind of casework and case management and social work support. They just don't have the resources to call you back, with stuff, or just pay that individualized attention. They've obviously got thousands more patients than the average pediatric hospital does, to some extent. But there is a cultural difference too, in that, one of the big things is in the pediatric world, we know that we work with the parents or with the caregivers or with the guardian on stuff and making sure that the child gets what they need. Whereas in the adult world, it is a little bit kind of more like you're on your own to find like maybe 4 different specialists or something like that. Whereas in pediatric centers, sometimes, many of you might have experienced, you have like a one-stop clinic where you can see a nutritionist, a neurologist, a social worker. They have, especially for complex conditions, where we know that there's going to be multiple specialists involved. Very often in pediatrics, we tend to frame those together. So there are some cultural differences that, we do our best to prepare for and know about and make the most of, because there are some good differences too. So how to start thinking about transition? I think, when we did this at Lurie Children's and we asked a bunch of providers what they felt, the biggest things that kind of came up were these words that you see on there, one of those Wordle type things. As you can see, everybody really wants it to be seamless, and I think, our families would agree. You'd want it to be definitely centered around your children, your loved ones. You want it to be collaborative. Those are kind of the big 3 that kind of come out of this. This is to give you guys an idea on this as to what you should expect from your team, or what would be ideal and what your teams are probably working towards if they're thinking about transition in a, let's do this really well, let's put a lot of effort into this and kind of way. It's called the 6 core elements of transition. This was created by a group out in DC. It's become sort of the nationally accepted standard for how universities and academic centers should be thinking about transition. I'm not sure if I go through all these in here, but one of the first ones, for example, the first core element of a transition program is to have some sort of a guideline that they share with you all. So how many of you guys, that's a good question, out of the 3 of you guys that are here, have you seen a guideline? Have somebody shown you something that says in writing somewhere that, hey, at the age of 19, we'll start looking, at the age of 20, we might introduce you to somebody, at the age of 21, we'll probably have you see that person, something like that.
In our rehab doctor at Children's, they now hire a person that sees older kids.
Mm-hmm.
Okay.
With neurology, they're like, well, we think I'm doing it a little longer, so we don't have an end date yet.
Right.
They both are working towards, not, it's Children's Hospital, they do have their adults there, so.
Right.
They're working on more, gaining more than adult providers, so we think neuro and rehab will get.
Yeah, and a lot of children's hospitals are doing that. They're working towards, so don't panic if you haven't heard anything. What this generally leads to is just ask the question at your next appointment. And that's how we generally start most of our families, especially at the age of 17, right? You said, or even around the age of 18, because with the rarer conditions, with the more complex conditions, like all of us here, they do tend to keep them longer. I mean, that's the way it kind of goes. We know that from the data nationally. We also know that just in practice. Because it's just harder, all those barriers that we talked about earlier, and the difficulty in transition. Plus, everybody knows your children and they know how to treat them. And, 18, 19, 20, 21, those are all vague ages for pediatrics versus adult. But just ask them. That's what we always start off by suggesting. Ask your other providers. But yes, many of people are kind of hiring people along. And the advantage to that, presumably, is whenever it does happen that you end up going to the adult side, it's the same person. And they just take you over to wherever their adult clinic might be. And it's very possible that they do. I know we do with Northwestern. For example, Lurie Children's with Northwestern. Some of our groups bring providers along from Northwestern. They start seeing the patients at Lurie Children's. And then when the person's ready, 25, 26, 24, whatever, they go seeing the same doctor, different place, but same doctor. So it's a little bit of a smoother transition that way. And then your teams are communicating with each other. But it starts with a guideline. It starts with having something in writing. This is what we encourage from people. And if not, maybe just ask them the question. I don't actually go through all the 6 core elements for you all. It's not that relevant. But one of the core elements is actually helping you, either the caregivers or your children, as much as they're able to do, to learn as many skills and abilities and things as they can. And if your child can't do it as much as they can do, then the idea becomes that the caregiver should know a lot of these things. There are a ton of these lists out there. There are checklists for transition readiness checklists, they're called. I looked for one before coming to this conference specifically for leukodystrophy or white matter diseases or whatever. Couldn't find anything specific, but at the end of this, I do have a couple of good resources and articles I found. But there's a lot of general ones that exist out there that can work. So if you're working with your child or your grandchild, or even thinking about yourself, what kinds of things I might want to do, you can pull out one of these checklists and see. And this is examples of others that exist out there. There's a whole bunch.
Right. So the 6 core elements that we talked about, that's from an organization called Got Transition out of Washington, D.C. And they have, I think their website is gottransition.org. And they have, that website is for families. It is for patients. It is for doctors. It's for researchers. It's very easy to navigate, and there's a ton of resources on it. The resources that are up on the screen right now are from the Illinois chapter of the American Academy of Pediatrics, and those, I believe in a later slide, we have, those are from the The Division of Specialized Care for Children here in Illinois has a really good transition handbook on their website that's very easy to find and easy to navigate, and they have a ton of resources there, usually between GOT Transition, DSCC, and our website. There's a ton of resources on transitioning to adult care.
So in terms of getting yourself or your children ready, what can they do? I mean, these are just some ideas that we actually, I pulled this slide off the talk I give to other residents and other providers as to what they can help our families do. So, describing the main aspects of how it affects you or your child personally in about 3 sentences. 3 sentences, somebody actually did a research on this. It's not just made up, 3 sentences. Somebody found that 3 sentences is a good medium between really kind of explaining something substantial. So you're not going on, about like a whole doctoral dissertation on it, nor are you giving like a one-word answer that, doesn't have a lot of substance to it. So somebody came up with 3 sentences. We've used it. Having an organized way of keeping track of your medical summary is a great thing to do. And then, as best the ability that your children might have, having them make their kind of own appointment. And then preparing some questions for them. A lot of people have phones now. They can come in, they can ask their own questions and things like that. And we know from a lot of the young adults we work with, one of the biggest things they're afraid of is making a mistake. They get nervous. They get, and even as adults we do. I mean, I get nervous going to a doctor. So that is one of the things people are afraid of. So we really want to get kids as confident as they can, and their caregivers as confident as they can, just talking and asking questions and not being worried about making a mistake. The other thing that your teams should be helping you out with, and at least kind of just mentioning, is, in this total overall assessment, this transition readiness checklist we're talking about, are the things that change when you enter into adulthood. Actually, you want to?
Yeah. So when we talk about assessment of youth, there's a whole bunch of things that happen when our youth turn 18 and when they turn 19. So I can only kind of speak to law in the state of Illinois in terms of changes, but guardianship or any kind of shared decision making is obviously not just Illinois. It's nationwide in terms of when a young person turns 18 in the eyes of the law, no matter what their level of ability is, they are their own guardian unless folks go to court and pursue guardianship of their adult child. In the state of Illinois, I would say it's going to be 2 years this February. We have a new law in the state of Illinois called shared decision making. So that is it's an alternative to guardianship. Guardianship is still here in the state of Illinois, but shared decision making is for young people who may have developmental delay or disability or an intellectual disability, but still want to be able to make their own decisions and want to do that with what they call a supporter in the law. It is an alternative, like power of attorney for healthcare is, limited guardianship also. So there's a lot of alternatives to full guardianship that are maybe appropriate for folks. The Illinois Guardianship and Advocacy Commission here in the state of Illinois is your one-stop shop for information on adult guardianship, limited guardianship, power of attorney for healthcare, as well as supportive decision-making. So I believe it's IGAC is their acronym, but the Illinois Guardianship and Advocacy Commission has a wealth of information on their website about decision-making choices for when your young person turns 18. And again, whether or not you're in the pediatric world or in the adult world, I've had families for a host of different reasons, they may not have the guardianship. You can't do it before the young person turns 18, but kind of struggle with my young person can't really sign this, but having health systems and educational systems and financial systems wanting the young person to sign, and that gets really kind of awkward and hard. So there's a lot of information on how to kind of jump in right at that, right? I think really you could probably start maybe just a little bit before that 18th birthday, but you can't actually file for guardianship until the young person turns 18. So guardianship or decision-making is a huge area of assessment for youth as they get older. Insurance, benefits, future financial planning is huge for our young people with developmental delay, intellectual disability, medical complexity, right? So in the state of Illinois, at 19, pediatric Medicaid ends, and then young people have to apply for Medicaid as an adult at the age of 19. At 18, Social Security disability, if your young person was getting it as a child, again, they have to apply as an adult. And the Social Security system, probably don't have to tell anybody in this room, is rough, right? And the adult bar is set exponentially higher, at least, from what I have experienced here in Illinois. It is really set. I'm biased, but I think it's set against, granting people benefits for disability. So that can be a rough system. So that's stuff you want to start thinking about and planning for as your young person gets older. A lot of, community resources, right? So in terms of educational resources, career, vocational planning, so young people with an IEP can stay in school services, typically a transition program, through the school year where they turn 22. It used to be extended the law. It used to be when they turned 22, they would have to leave school immediately. But we changed the law, and now they can, when they turn 22, they can, if they're in the middle of a school year, they can finish that school year. Financial planning is huge. How do you protect benefits for your child, your special needs child? So there's special needs trusts, there's ABLE accounts. There's a whole lot of financial planning that goes into wanting to protect your young adults. Again, we'll share our website at the end of this. We have a great webinar on our website done by a financial planning group that talks about how you can do this, because the laws around how much assets a young person can have and then still get disability is pretty tight. It's $2,000. So, but there's a lot of other venues for you to and for families to put money into to protect the assets of their special needs young person. So these are all things to kind of think about. Again, along with the medical stuff, there's medical stuff isn't your young person's whole life. They're more than just their diagnosis, right? There's just all this other stuff that comes along with life as your young person gets older.
So after creating sort of that, that readiness assessment that includes an assessment of all those things that we just talked about, one of the things that we do, that we encourage our families to think this way, is to have some sort of a transition care plan. So this is a kind of a case just that I've sort of made up, but it's a compilation of real cases that we've had that I kind of put together. And, this could be familiar to some people. What we try and think of is, what are the medical conditions that need a specialist or a care provider? And who is the strongest quarterback, primary care doctor that can kind of help you all navigate through this system? So we'll start with a list, something like this. In this case, this is just meant to show, and some of you probably relate to this, is, you can have multiple specialists that are involved here, right? And then what we try and do is we create a care plan that looks something like this, where first we're assessing those knowledge and skills. And, as you all probably are, you're great advocates for your loved ones. And so most of our families are. And so the parents, when they need to, are very able to list their conditions, medications, and providers. But it does help sometimes to kind of organize it that way. I can tell you as a physician, if somebody comes into your office and sits in, it's a brand new person with something, a couple of complicated medical conditions. It's great if I can have a list of meds, a list of providers, and a list of conditions and sort of link them. So it's one way to think about it. But then we start thinking about an adult care plan. And there's nothing magical. There's nothing actually medically sophisticated about this transition care plan. This is something that we came up with in the way that we organize how we think about how we try and help our families, and how we help them kind of organize their care, and how we make a plan moving forward. So we talk about who you're seeing. I'm a primary care doctor, so we tend to think in terms of primary care, and we believe that a strong primary care doctor can help most of our families navigate the adult system probably better than we can, or better than any one of the specialists probably can. And so having a primary care doctor that knows a little bit or is willing to learn is also willing to help kind of navigate that system, find specialists as you need them, and coordinate when one specialist says something and another one doesn't quite agree, can kind of help navigate that for you. Plus, can be your first call, who's easily accessible and convenient. We do believe that primary care in general should be convenient and easy, easily accessible. So we start there. For you all, how far are we from Chicago? It's probably like 45 minutes to drive out here. Depending on where you all live, there are providers called med-peds providers, and I don't know if anybody's ever encountered any of them. they are board certified in both pediatrics and internal medicine. And that puts them in a unique position to take care of children who are entering adulthood with pediatric complex care diseases. So they're board certified pediatricians. They know, they've got experience with children with complex conditions. And they know how to take care of general adult health maintenance. So we actually happen to have connections with a lot of them in the city. In the Chicagoland area, we happen to be blessed compared to the rest of the country with a bunch of training programs for med peds, and then those people tend to stick around the area. So they exist, they're out there. You wouldn't necessarily know it, but maybe there's somebody in your practice or somebody that you might be looking for. Or you can probably look it up online and see, and they are really well positioned. Most of them tend to enjoy taking care of young adults and pediatric patients growing up. Certainly all the big university centers have them. So Rush, Loyola, Northwestern has a team there that we use. University of Illinois and like UIC and University of Chicago all have med peds clinics that are in there. I happen to know a group at OSF who does too. And out here, I don't know. Oh, okay. Gotcha. Gotcha. Yeah. We know the pediatric team out there pretty well, the pediatric transition group that works out there. We meet them at national conferences all the time, Colorado Children's and
well, also, I mean, we work with internal medicine and family medicine doctors too. Family medicine sometimes is a good fit because the family medicine doctors can also serve as an OBGYN if you have a young female, right? So then you don't have to take, a lot of our families like, oh goodness, my young person's never been to see an OBGYN yet. And do I have to take her to a separate place? And if you have a family medicine doctor who you have a nice relationship with, that's kind of a one-stop shop for gynae care as well. So that sometimes is a nice fit for some of our female young adult patients. So again, we love med peds. They're great. They train to take care of medically complicated kids. This is what they do. This is what they go into this field of medicine specifically for. It's a longer fellowship program in these different programs, academic medical centers throughout the country. So we work with them, but obviously we've got great partners in internal medicine and family medicine as well. So there's a lot of good choices out there.
And family medicine also takes care of kids and adults,
yep,
and can often take care of the whole family.
Yes.
So, again, the most important thing is that convenience, that they have access to the specialists that you need, and they're willing to be that quarterback. That's a good fit for you and your family. And there's just a variety of people out there. For specialty care, one of the ways that, I think we find it beneficial to think about is kind of laying out each specialty that you need and seeing where they are currently in their transition phase and what you might need moving forward. So we like to get a little bit of a history of what's going on. And I pulled some. These are all kind of real examples pulled from different people. This patient, for example, is seeing somebody in another state kind of virtually now that that's taken off. And I think you all probably know better than I do that CHOP happens to have the Children's Hospital of Philadelphia, I think, happens to have a large center, a really good center for leukodystrophy, and this patient was seeing them. So what we would then try and look for, or try and at least ask around and think about, is even if there's not a neurologist in our system here who has that level of expertise, would they be willing to work with them? And it's something that our families can actually ask them when they go and meet, call, interview, whatever. And then we do lay out the other specialists, mainly to make sure that there is nothing emergent or urgent going on with some of these. If there's a surgery coming up, then, the best option might not be to transition some of your care and then keep a surgery, because then what if you end up getting admitted and after the surgery or something like that, or if there's an active care plan where they're weaning some of your meds, if your neurologist is like either weaning or increasing your meds, or you're having some increased seizures or something like that, and you just want to take care of that and get to a point where you're stable, and then you kind of make that move over when everything's good. So we're just making sure that everything is kind of in line before, and then we tend to kind of center everything around either the primary specialist that you need, which is a neurologist for the most part, I think, or the primary care doctor. Does that make kind of sense? I don't want to harp on this too long, but it's just a way to organize it and the way to think about how you're going to transition. And then, like Angela was talking about before, we definitely want to make sure that there's a plan for where is your loved one, going to stay, whether it be with you and the family or, as independent as they can be. Whether they have a plan for some sort of recreational, activity or anything that we can find out there. And, are there insurance and benefits? Is their insurance going to carry over to adulthood? If you are receiving SSI, making sure that's going to continue, and if you haven't received it before, making sure that your child may be newly eligible. And in Illinois, the PUNS waiting list. As long as people, does everybody know about it already, or you might not?
Okay.
Oh, you're not from Illinois either.
Then that's okay.
Oh, gotcha,
That's okay.
gotcha.
We won't spend time talking
All right.
about Illinois specific things.
All right. Never mind. Does something like that exist in every state? I actually don't know. No.
I don't know. It's Illinois got a kind of a draconian system for taking care of young people with special healthcare needs and special needs. So we won't spend too much time talking about that. We'll kind of talk more generally about transition resources as kind of we go along. So in terms of transferring care, so obviously finding and choosing adult providers. How do you find an adult provider for your young person, right? Great resources, your already trusted pediatric team, right? So you trust your pediatric team, who would they refer you to, right? Family and friends, online, leukodystrophy groups is another idea, like groups of parents, right? When you come to conferences like these, talking to people who might be regional to you and like, what have you found? I had one, we met a mom downstairs and she's like, my kid is the first one in the whole group turning 18. So I'm at the front line of finding adult providers. And I think everyone's kind of watching and waiting for me to find adult providers and see how that goes. Your insurance company, in terms of like, obviously being very specific about, okay, who's covered? Nobody can afford to go out of network for anything. So it's like calling your insurance company and seeing, who they would recommend. Internet provider locators. I don't know that a lot of our families have necessarily had a lot of success with that. Care coordination. Again, I don't know if, care coordination is available in all the settings where you guys get care. Insurance companies will often have,
You might not know that they are available. I mean, hopefully somebody would have mentioned it, but definitely, I think it's something to ask your team because it's becoming a big thing nationally. I mean, you see it around a lot of transition conferences.
Yeah, but a lot of insurance providers provide care coordination for medically complex young people to manage those benefits and the costs, right? Because that's what insurance companies are very worried about costs. So they want to kind of make sure that patients are getting the right care from the right folks at the right time. So care coordinators is another kind of resource. But certainly your current provider should have someone to refer you to. So whether or not that's your pediatrician or your neurologist or any of your other specialists, hopefully they will have an adult counterpart that they feel like they want to refer you to. And we find in the literature, folks are more likely to go see an adult provider you get the name from, your pediatric provider. You're more likely to go see that person because you trust your pediatric provider, right? Certainly that's probably true for most of us. If our primary care doctor said, oh, I know a great guy who does, knee surgery, you're more willing to go see that person because your trusted, physician has referred you. But obviously there's a lot of factors in seeking out adult care. So if your child is medically complicated, you might not be able to go to just maybe a community clinic. You may need to go to a larger medical center, right? And you may be already going to a large pediatric center. So you may want to go to a lot of pediatric centers are maybe not, some of them are affiliated directly with larger adult medical centers and some are freestanding. So does my kid really need to go to like a larger university setting because they see maybe 3, 4, 5 different specialists, right? So a lot of times we need that access to specialists. Geography. People travel great distances for specialty pediatric care, and we know that. We always do think that primary care should be as close to your house as possible, right? So it's all about geography. It's about your insurance. It's all these things that kind of have to be taken into consideration when you're looking for adult care for your young person, right? And again, primary care and specialty care may be different. We have some young people who want to stay in the neighborhood for their primary care, but then they travel a little further, maybe into the city for a specialist for their young person. So, we like most families prefer to have all their care in one medical system, but some people don't mind if they've got to kind of maybe go to more than one, medical system for their care. Unfortunately, here in the state of Illinois with Medicaid, our children's hospital, for instance, we take all the different Medicaids that are in the state of Illinois, but that is not true for the adult health system. So finding out, again, starting early with transition is really important, because if you have identified an adult medical system where you want your young person to go, you want to make sure that they take your insurance. So, and if they don't, you've got maybe a year or two or a couple of years to make those adjustments. And the payer mix on the adult side tends to tighten up a little bit with Medicaid insurance. So that's something to kind of be aware of. Because of that, some of our young people that we see sometimes go to what we call an FQHC, or Federally Qualified Health Center, and those are available all along, nationally. And sometimes we have young people that's a good fit for their primary care, and then those doctors refer them into larger academic medical centers for their specialists. And obviously, as great advocates for your young people already, you do probably a lot of research about where the best doctors are and who's the best at what. And that's a lot of how we find parents are looking for specialists for their young people. And again, like I said, most people like to keep that care together, but we've worked with families who are like, I'll go to 2 or 3 different places if somebody has a better neurologist, but my GI specialist is at a different hospital. So that's all family preference, and you guys are the experts on your own young people, and should be honored as such. So it's really individual per family in terms of like what you feel comfortable with, and you've got to it's got to be a good fit. Somebody can be an amazing doctor, but if they don't have a good bedside manner and you don't really click with them, it can be hard to keep, getting care from that person. So it's always important that it's a good fit for your family. Yeah.
So when it comes to actually transferring the care, there's a lot of, you want things to go smoothly. You want things to go right. You want your new doctor to have some information about you, your family, your child. There's no particular set way to do it. We tend to try and find the primary care doctor first and keep some of the pediatric specialists intact, so that adult primary care doctor, you don't have to wait for wait lists, essentially, or something like that. If that adult primary care doctor has a great neurologist or a cardiologist or something that you need to see, they can make that referral. You don't have to worry about it, because you're still seeing your pediatric neurologist and your cardiologist until that wait list is up. And so that's how we tend to do it, but that's not necessarily saying that's the right way or the wrong way to do it. That's just one way to do it. We do rely on the adult primary care doctors, and you should too, to help you find those specialists. That's one of the key things about finding a good adult primary care doctor, somebody who has access to the specialist you need. Often for something like these, like rare conditions, like with your children, it ends up being in a university setting, or somebody that's at least affiliated with a university setting, so can have access to all those specialists at the university.
And what happened to you guys, you had kind of an acute condition where you had to, before you were even kind of ready, you had to jump to an adult provider, right? And so, okay, now it was an emergency, and now we're kind of in this system. And generally when we talk about transition, we say, we should avoid having it during an emergent kind of situation, but sometimes it can't be helped. Sometimes it can't be helped. What we have a lot of times is young people may be held on by a specialist, and say they develop a new problem, because our young people, just like all of us, are getting older, and none of us get healthier as we get older, right? And what we have in our system is, say you're seeing a neurologist for years and years and years, and they've never seen a pulmonologist or an endocrinologist, and they develop a new problem. If you're over the age of 18, usually those pediatric folks won't see you as a new patient. So then we have families kind of forced to go into the adult system right away, and that can go a lot of different ways, as I know you guys have experienced, and that can be really hard. So trying to plan around that PCP first, and then having it be more planful is obviously the way folks would prefer it, but sometimes you don't have that luxury. Sometimes your kid needs adult medical care, and you just need to roll with it.
And then sending records or transferring records from one place to another is always kind of tricky. You want, and this isn't up to you, but in thinking about it, we always want to be able to send a nice, small, but concise and thorough medical summary. You don't want it to be too long, because unfortunately, the way the reality is that people won't read it if it's too long. And you don't want it to be too short, because you don't want to miss out on vital information. So it's tricky. It's not something that's necessarily in your hands, but it is something to be aware of, that records should be transferred, and everybody's looking for this like holy grail of an incredibly auto-generated, concise medical summary that they can send and the adult providers would get, and everything would go really well. Most neurologists will know exactly what to send to adult providers, so they'll send a curated record, hopefully. And now with the electronic medical records, a lot of people can see nationally a lot of the different, there happens to be one dominant player in the industry,
Right.
and they tend to share records pretty well.
Right, and that's something you should definitely ask your pediatric specialist and to check with before you go to see your adult specialist, because the largest player in the electronic medical landscape right now is Epic, right? So there's something called Care Everywhere, and if you grant permission, that allows other folks who use Epic to be able to see your child's record. So for instance, if we're seeing a young person at Lurie Children's through Care Everywhere, I can see every hospital, as long as the family gives permission, I can see every hospital that they've been to and the records. Sometimes outside, if your child has never been to that new adult medical institution outside of the first visit, sometimes the doctors can't see those records. So that's something really specific to ask, right? So as much as possible, leveraging technology to your benefit. Most folks have what we call here, it's My Chart, so an electronic way to be messaging your doctors. Your medical systems ask if you're able to get some of your records downloaded to your My Chart. Okay, some medical systems will let you, they'll download it to your account for a specific amount of time, but you could just, transfer that onto a drive or something like that, like in that period of time. So you could maybe, also have a drive with something on it to bring, et cetera. But with these days, with the electronic medical record, you hope that there's no more faxing, right, or things like that. But we do know that does still happen. Like I would say maybe a year ago, I was, faxing records to a new doctor's office, because what we find is from all of our families we've ever talked to, if that new adult doctor has some records beforehand, it just makes the visit go so much better. If they don't know you yet because you're not in their office, but they know some of the struggles and some of the medications and some of the conditions before you sit down in their office. So it's always a little comforting that the new doctor knows something about your child before you go into that first appointment. So it always goes better if those records are transferred ahead of time. Certainly doctors roll with it. A lot of times the records are not set and they roll with it. But it usually, I know, makes a lot of our families feel better if they have those records ahead of time. But see as much as possible how you can leverage technology to make sure those records are sent, or that they can see those records in the chart. Certainly if they can't, you can then talk to your pediatric practice about sending them over. Or having them downloaded to your My Chart account. That's also another way you can get access to those records.
Organizing your own care. What?
We kind of went through this.
Yeah. I mean, these are just some of the categories to think about. Like the big one is really linking those conditions, medications, and providers. It's really nice to have that linkage or to think about it that way. Sometimes it helps. But just don't forget about some of the other things like your equipment, any feeding things that you guys use, and really how it affects you or your loved one. That's really the focus behind how you want to sort of start talking about things.
Or if your child needs any paperwork for a state waiver system, a lot of times there's a lot of paperwork to be filled out to continue orders, right, for either feeding equipment or home nursing, et cetera. You're going to want to make sure that the nurse and the new doctor and their nurse understand, asking them, hey, what's your protocol? How long beforehand I need to be sending your request for a letter or for some paperwork that needs to be filled out for my child's home health company or for our state waiver program, right? So that they kind of, have a heads up about that. That's an important part of kind of the medical summary as well.
So this slide I just want to touch on just for a second. One of the things that we actually tried out that went really well, not for leukodystrophies, but for Turner syndrome and other, was that that exist out there, kind of, common things that adult doctors need to think about as somebody with a certain condition when they age. And it's very medically oriented. These are all from medical literature. But not all primary care doctors are going to know exactly what to screen for, what to look for, and what to think about when seeing your children. Now, obviously you want to work with somebody that might have some experience with it, but that doesn't always exist. One of the things that turns out really helpful is a lot of societies, and this is actually pulled off, I think, a Neurology Society article. They published a bunch of tables that are what to do, kind of guidelines for somebody that's taking care of a patient with leukodystrophy, but doesn't have a lot of experience taking care of thousands of patients with leukodystrophy, or hundreds or tens for that matter. And these have been found really helpful. So we did this for another condition, and we sent it along to the adult providers, and they loved it. And they're very experienced providers, and they know how to take care of patients in general, and how to read one of these and make sure everything gets done. And so, knowing that these kind of exist can help. Possibly your current pediatric teams or your neurologist might know about it. Or just knowing, and this is actually not pulled off the medical literature. This was actually pulled off and I have, I think, a couple slides in the future. I have a list of sort of resources that I found online that you all are probably more aware of than I am. But this was actually pulled off of one of those. So this was off of a family site, this article. And this article happened to have about 4 or 5 of these tables for various different things like sleep, pain, and general health maintenance. Again, like I said, we've had good experience sending it off to adult providers. It actually helps the adult providers a lot. As a provider myself, I would love to have one of these, because if I saw a position statement with guidelines on it, I feel a lot more confident and comfortable helping my families. And I think, many of your providers might feel the same. I can skip over that.
We talked about this a little bit, the shared decision-making in terms of a whole, there's a whole range of different things to take into consideration in terms of shared decision-making on the way to full guardianship. Check with your own state about what the rules are around guardianship, because it's going to be different. Every state's got their own laws in terms of, the only thing that stays the same is when they're 18, they are their own guardian, right? But then every state is very specific on how this happens and where it happens. So please check with your own state about how this happens. Certainly, I know we had one of our social workers in here before. Ask one of your social workers at your children's hospital if you need help or guidance or a referral to a legal advocacy agency, anything like that. Please reach out to your social workers at your hospitals. They will know how to help you with this and will be much more savvy in terms of the law in your specific state on guardianship and alternatives to guardianship.
Or conservatorship, as it's called
In some states, yeah.
But in general, I think the idea here is that we want, and most of the families we meet want their children to be as independent as possible. So the least restrictive option is generally the one that we pick. So that's why I like to show this arrow kind of, the spectrum, one end just being really nothing legal, just having a good trusting relationship with your family. And the other end of the spectrum being full legal guardianship or conservatorship that you happen to obtain. Health insurance options, this is generally true for most people across most states, not all actually. But, it ranges from private insurance from the families to adult Medicaid, which, again, so many states.
Yeah, just in Illinois is it no longer based on disability. It really, in many states, but it depends on what state in terms of whether or not they expanded Medicaid when Obamacare was passed. So here in the state of Illinois, it's no longer based on disability, but still based on income. So and many have to be in managed care plans, except sometimes young people who might be in a state waiver program may not need to be in a managed care program. And obviously there are health insurance exchanges, but these get tricky because I know specifically the health insurance exchanges in the state of Illinois, our children's hospital doesn't take any of them. So it just depends on what programs your hospitals are in network with. So, but health insurance, we can't state this is enough. It's the cornerstone of, securing good quality care for your young person and making sure that they have good health insurance options as they get older. Obviously, Medicare and college university insurance are other, kind of options as young people get older. And then certainly the young people that we work with who are undocumented immigrants have very little options for health insurance. But those are just other considerations in terms of health insurance when you're young, as your young person is getting older. So again, our transition program at Lurie Children's Hospital. It is a publicly available website that we have, and it's got some, Illinois specific things on it, but it also has some good general transition resources on it as well. This is the website. I don't know I don't know how will you guys be able to have access to this PowerPoint presentation? Do you know through? Perfect. Okay.
Yeah, you'd have to
Perfect.
like literally type all
Okay,
But
okay.
If you Google Lurie Children's transition to adult care, it's the first thing
Yeah.
that pops up.
Yeah. So a lot of good resources there, and Got Transition, which is a great website, which is a national clearinghouse for transition. Great resources on that. What we, kind of just a little bit about we do.
Again, this
Yeah.
is sort of because some of your programs in whatever state you go in, especially if it's an academic, like a university type setting, we tend to copy each other. They might have something like this too. You may have a clinic somewhere there that can help you kind of coordinate the transition to care. So like a lot of people around, even at Lurie Children's, don't necessarily know about us. We're actually pretty small within our own hospital, but people are learning and people do it, and when people come, so you might want to ask, or if you see something on your website. And then we have programs like, we happen to have on our website, which is this, a lot of the videos, since the pandemic mainly, we've done most of our stuff virtually, so we've been able to record them and put a lot of videos up from a lot of our community partners, legal partners, financial aid partners, guardianship partners, government partners, on our website, and we've recorded their talk that they would otherwise give to a session for families or something like that. So that's our sales program that's really gone virtual. But again, your institution may have something like that, or they may have community partners that they work with. Ask your social workers, ask your teams over there. Or, a lot of the information is general. It's not all Illinois specific on our website. I mean, actually, most of it probably is general. And then the general transition resources. This is the site we've been talking about the whole time, which is gottransition.org. It is a one-stop shop. They are currently probably the leading national organization with everything related to transition, and they have a section for families, for patients and families. They will have their versions of everything we talked about: transition readiness checklists, medical summaries, kind of like how to talk to your provider, what kinds of questions to ask, all the stuff that we kind of talked about on our slide. They'll have very nicely, professionally done, like pamphlets or handouts or web pages for all that stuff. So definitely peruse that if this is something that you're worried about, or something that's kind of keeping you up. I did, like I said, before this conference, I wanted to make sure that I had at least scoured the web for what I can find specifically related to leukodystrophy. And there are some great ones, and you all probably know these, possibly even better than I do. Some of these have links to other resources. So I think that CHOP one was the one I got some of these other ones from. And then as going through all of them, I saw some of these were really, really good. That Hunter's Hope one, was the one that had the articles on there, which is really great. But CHOP, we do hear about it even from our families that we take care of with leukodystrophy. This is Children's Hospital Philadelphia. When I say CHOP, this is in Pennsylvania. They had a poster downstairs or something like that too. So they do have some expertise in this area, and I know they do, for example, video consultations with some of our families here in Illinois. But these resources do exist, and I don't know why I keep the sound on here. It happens to be a text messaging reminder system for your medications and stuff. It works. The only reason I put this one on here specifically is because it has been studied in the literature, and it tends to bring up levels of, or if happened to be transplant. But there are a lot of these resources that exist out there. I think in the end, if you want to sum it all up without worrying about a lot of the details, just know that we want it to be, and I'm sure you want it to be, a purposeful and planned movement. This is not something that oh yeah, it's time to go. We want this to be organized and well, seamless, all those words that we saw in the beginning. It's a process, not just like a transfer of care. It's not just oh, okay, we're going to send you to this doctor. We want people to be ready, the readiness checklist. We want people to know about it ahead of time, and we want it to be planned. What about all the other specialists? What about all the other people you see? And what about your life in general? We want to make sure that that is also planned. So for that reason, we like to have these consultations early. The literature, interestingly enough, suggests like 13 to 14. But what they're really talking about is kind of introducing that concept. So I don't know how many of you guys even thought about this at the age of 13 or 14, or somebody introduced it. Probably not. And honestly, most families and most providers, if you ask them, they're like, oh, 16 sounds like a good age, 17, something like that. But I think 13, we talk about it just to make sure that families are aware that this is going to happen years down the road, so you're not hearing about it for the first time at 18 or 19. This is us. So if, obviously it's Lurie Children's specific. So, but there might be somebody at your institutions that might help you out with this.
Yeah, and we give this talk because we want people, we already know you guys are great advocates for your young people, right? And it's important to be great advocates about transition, right? Because I don't know any special needs parent who isn't a planner. There's nothing more terrifying than like not knowing what's coming around the corner. So that's so true about transition. So we've seen kids in our clinic and the family's like, okay, we see like 5 different specialists and no one's talked to us about transition, and we don't know when it's going to happen, because it's not like they all decide to do the same thing. They're all going to want to do something different. So folks want to plan. They want to know what's coming next. They want guidance. So start being the best advocate for your young person and start asking all of your doctors, how long are you going to see my child for, right? And is this still a specialty they're going to need as an adult, right? And then what's your plan, right? How are you getting me ready to move to this adult doctor? And do you have a colleague who you're going to refer me to? But yeah, ask for help at your institutions where you go. Again, they may have specific healthcare transition programs at your institutions. A lot of pediatric hospitals do have transition programs. And certainly, if there's any, I know we're Illinois specific, but if there's anything we can do, please don't hesitate to shoot us an email. But I know we're here in Chicago, but we're always super happy to help if there's anything we can do to help. Does anybody have questions or comments or anything?
Hopefully people found it somewhat helpful, or
Yeah.
maybe just, the idea was to give you kind of concept of how to think about it and how we think about it, and
Some resources. Yeah.
Resources. Yeah. Hopefully that was helpful.
Thank you guys so much.